World Heart Day 2021, a way to create awareness about the importance to keep your heart healthy. Firstly, hello, I'm रेशम और आप देख रहे हैं DNP Health. पहले तो वेलकम बैक टू आवर चैनल. अगर अभी तक आपने हमारे चैनल DNP Health को सब्सक्राइब नहीं किया है, then what you waiting for, प्लीज कर लें. और इस वीडियो को और हमारे चैनल की बाकी सारी वीडियोस लाइक ऑल द वीडियोस दैट यू लाइक एंड लव उन्हें भी प्लीज शेयर करें. थैंक यू. सो हार्ट अटैक एंड sudden cardiac arrest are two terms that are often being used interchangeably, even though both are way too different from one another. कभी हम हार्ट अटैक बोल देते हैं तो कभी कार्डिक अरेस्ट. वी थिंक इट्स सिमिलर. इट मीन्स द सेम थिंग, बट इट्स अ बिग नो. Yes, you heard it right. So आज के दिन इस पूरी confusion को clear करते हैं and जानते हैं the major difference between a cardiac arrest and a heart attack, and also the major steps that should be taken later on. But wait a minute, it won't be fair if I am the one to talk about and elaborate on this particular topic. इसलिए इस बारे में let's talk to an expert and speak to Dr. Sanjeev Kumar, who is the MD physician and senior RCTVS from Max Hospital. आइए जानते हैं डॉक्टर संजीव से difference के बारे में and take his point of view. Firstly, thank you for connecting with us. And today is World Heart Day 2021. So I would want to know your take on that and your message to our viewers. Firstly.
I would like to thank you for joining me to this Heart Day celebration. I would like to tell viewers some important tips and takeaway for healthy heart and on this World Heart Day. The thing is that healthy heart can be kept by doing exercises, leaving bad habits like smoking and eating fatty rich food. And one other question which you have asked is how to keep your heart healthy and what's the difference between heart attack and this cardiac arrest. So taking this further is cardiac arrest is when the heart stops. Okay, so that is one thing, but it is a follow-up event of heart attack. Heart attack is when the blood vessels get blocked by some fatty plaque or something, some kind of mechanical obstruction. So the heart muscles do not get enough of blood supply, and that leads to the heart attack. Okay, so the major difference between heart attack and cardiac arrest is the heart attack is the first pre-leading situation where the heart gets less of blood supply, and consequently heart when stops moving, it is called a heart arrest.
So the heart attack leads to a cardiac arrest. That's the thing.
Right. Okay. Right. So, yeah.
And so, like you mentioned about that. So, firstly, if I would like you to talk about the heart attack, the first thing that what can be done when an individual faces a heart attack, if you could talk about that.
See, a healthy person or other person, there are certain risk factors which can be avoided. Those include smoking, habits of taking rich fatty food, sedentary lifestyle, and less of exercise. So if these are modifiable changes, lifestyle changes which can be done in one's life. So if people tend to be more active, dietary changes, having rich fiber diet, and regular walking exercise, 45 minutes of brisk walk, these can help you less the risk of about heart attack about to 20%.
Okay, sir. So, and like you said, cardiac arrest is a thing in which our heart stops. So, if you could throw some light on the survival rates of that as well. What are the chances?
If you get to the hospital, nearest hospital in a well before the time when you have started having heart attack, and then the survival rate is much higher, because nowadays we have therapies and we have medicines which can open the blockage. But once the heart has stopped and the time period has been lost, then it is very difficult for patient to be survived or revived, right?
Okay.
So the time is a crucial factor. If the patient is having symptoms, he should immediately contact nearest hospital or call an ACLS ambulance, which reaches the patient on his place. And well-trained doctors and nurses are equipped with medicines which can help save life.
Yes. So, like you talked about the symptoms, so if you can elaborate on the symptom, or are there any different symptoms that one faces during a cardiac arrest or a heart attack, or are they similar?
Heart attack is always started with sweating, at times of bloatingness or heaviness, or having feeling of some heavy amount of weight being put on the chest, center of the chest. The pain may go to the jaws, may go to the back or the left hand. These are the symptoms which are indicative that you are having some problem with heart. At times, patients who are diabetic may not have typical symptoms, but these are typical symptoms of chest heart attack. And if you reach the hospital within the half 30 minutes or 15 minutes of having this chest pain, and nowadays medicine and this cardiac medical devices have so advanced treatment that we can save the heart, and in fact the heart muscles can be saved, and eventually it leads to a better outcome.
And also, sir, can we is increase in the heart rate also a symptom? Like nowadays, we have an oximeter because of COVID. Most of us have it at our place as well. So, can that indicate a problem or anything like that?
Yes, at times it could be indicative that you are having some problem with the heart if your pulse rate is higher side, or it may also decrease.
Okay.
If you are having right-sided heart failure or right-sided heart problem, your pulse rate might decrease. So anything, but all of them will carry symptoms like having heaviness in the chest, pain in the jaw, sweating. These are typical heart uh, attack symptoms which you have to look into. And if the patient is having discomfort, so he should immediately contact nearest health system.
And so, what is the
or
normal
hospital.
pulse rate?
Normal pulse rate is anywhere from 80 to 60.
Okay, 80 to okay. And so, lastly, I would also like to ask, are the chances of sudden cardiac arrest actually increasing in the youngsters these days?
Of course, the habit, sedentary habit, lifestyle that have changed, and dietary changes which have brought in from the Western countries have increased chances of diabetes, and henceforth increasing the chances of having heart attack in younger population also.
And so, your last message to our viewers on World's Heart Day.
I would just suggest that people should change their habits and lead a healthy life, have good 45 minutes of exercise, that would lead to better heart.
Okay, thank you so much for
Thank you.
coming, sir. Thank you.
So for an individual जिसको पहले से ही heart conditions हो, knowing the signs, detecting them and responding to them immediately regardless of the time and place is very crucial, right? And I hope आज के segment में आपके major doubts clear हो चुके हो. So that was all for today's segment. अगर आपको हमारा आज का segment और content अच्छा लगा, then please do not forget to like, share and subscribe to DNP Health. आप हमें Facebook, Twitter, Instagram पे भी follow कर सकते हैं. Keep loving us, keep showering your love and keep watching DNP Health.